Okay. Okay, so today I'm going to be doing a little bit of teaching over a colonoscopy that you got scheduled for today. I know that you're so young and this is going to be your first time, and so I know that that can be kind of scary. So I'm just going to go over some basics of the colonoscopy, why it's important to have it done, kind of what the process and procedure is, how to get ready for it, what to expect afterwards, and then I'll go through some prep instructions. I will also give you a little handout for you to keep, and it just kind of goes over the anatomy of the colon just so you have an idea of how the scope's going to go. Okay, so I'm going to hand you a copy of these basics of the colonoscopy, which we will discuss first. And this is just so you have an idea of what's going to be done, why it's done, and how it's done. So first of all, what is colon cancer? Let me back up. I forgot to introduce myself. My name is Shelly, and I'm the educator here at the clinic. And so this is why I'm teaching you this stuff, okay? First of all, what is colon cancer? Well, colon cancer is the third leading cause of cancer-related deaths in men and women. Colon cancer is a cancer that starts obviously in the colon and the rectum, in the large bowel. The large bowel total is about 5 feet long. Just some basics. Cancer of the colon can start when the cells start to grow out of control, and eventually a mass can be created. Most colon cancers start out as a polyp, which grows on the inside of the lining of the colon or the rectum. And so that's the biggest reason that it's important to have a colonoscopy done, because if the polyp starts to grow over time, it gets larger and larger, it stays in place. It can eventually turn into cancer depending on the type of polyp that it is. Which brings me to my next subject, the different types of polyps that have the potential, like I said, to grow into cancer if they're not removed. The adenomatous polyps, these are the precancerous polyps. These are the ones that we don't want. These are the reason why we have the colonoscopy done, okay? This can potentially grow into a cancer over time. Sessile polyps are also at a high risk for growing into a cancer over time. And then there's hyperplastic polyps. These are the most common. These are typically not cancerous, but you still want to have them removed just in case. So these are the biggest reasons why it's so important to have a colonoscopy done. The only way to tell what type of polyp tissue, if you do have a polyp, the only way to tell what type it is if you remove it, and then they have to send it off for pathology to look at it under a microscope, and then that way you'll know what type it is. Depending on that will tell the physician when you need to come back and have this done again. So if you have a polyp, you don't have a family history, it's more than likely 5 to 7 years that they'll recommend you come back to have another one done. If you do have a family history, typically it's automatically 5 years that you come back. If you have an adenomatous polyp with a family history, sometimes it's 3 years. So it all just depends on what type of tissue is growing in the polyp. Once the polyp is found, or actually let me backtrack. Cancerous polyps that aren't removed, like we said, can grow into the colon tissue, or over time they can progress, go to the lymph nodes, and then they can grow into distant parts of the body. So that's when it metastasizes. It can go to the stomach, it can go to the lungs, the liver, the kidneys, and it just progresses from there. If you end up having a mass, once it's found, they have to do a staging. And so the staging is when they let you know, 1 is the least invasive, 4 is the most aggressive. So depending on what stage you're in, then a treatment plan can be created for you. So every treatment plan is different. Every cancer is different. So that's why they have to wait till the staging is done. So that's about all the basics that I just kind of wanted to go over what colon cancer is. It's the main reason that we have a colonoscopy done, is to detect for any polyps or masses that could potentially be there in the colon. Now for the procedure itself, which is what you're having done next week. And the colonoscopy, it's a visual examination, and it looks at the entire structure of the colon. So all 5 feet, if you can imagine, are looked at during the colonoscopy, and so it looks for any abnormalities, that's polyps, masses, any bleeding from irritation of the colon. Sometimes there's a different color pigmentation, sometimes there's ulcerations, but that goes into other diseases of the colon. But the main reason is to look for the polyps or any masses. It's done with the scope. The scope is about the width of my pinky, and so it's a flexible tube. It has a light and a camera source at the end so that the doctor can visualize everything. He looks at everything on a screen, so he can see as he's going. Like I said, it views the entire length of the colon. Any biopsies, anything that looks suspicious to the doctor, he can biopsy with forceps, and they're just kind of threaded through the scope. And then any abnormal tissue, he can biopsy as well. Polyps that are small enough to be removed, those can be removed at that time, and then they're sent off for pathology. Sometimes if polyps are too big, they have to leave them in place, and then they may have to be either surgically removed, or they can remove a little bit at a time. The full bowel prep, which is what sometimes scares people the most about having a colonoscopy, has to be done in order to get a clear and adequate visualization of the colon. So it's really important. This is one of the most important parts of the colonoscopy, is to follow the prep instructions as we explain them to you, so that they can get a good view of everything. The colonoscopy is the preferred method of screening because it looks at the entire colon. Biopsies, like I said, can be done. Polypectomies can be done. So this is just the best way to get a view of everything in there. The good thing about it, the procedure is very quick. Usually takes about 15 to 25 minutes. Anesthesia is used, so you're asleep the whole time. You don't feel anything. Since anesthesia is used, you'll need to bring a driver, so you can bring your sister with you, because you won't be able to drive afterwards. You'll be awake, but we still don't want you to drive because you're considered under the influence, okay? Some possible risk and complications that can occur after the colonoscopy, bleeding at the biopsy or the polypectomy sites. A small amount of bleeding is to be expected, that's okay. But if it's covering the bottom of the toilet, you can't see through the toilet water, then that's a problem. A bowel perforation is sometimes, it's very rare, but it can happen whenever the scope can perforate the wall of the bowel. That's very rare, like I said, but it is a possibility. An infection, so whenever you leave, they'll remind you to look for signs of infection, fever, vomiting, nausea, chills, anything like that. But all of that, you will be reminded whenever you leave the day of the procedure. Also, a reaction to anesthesia. This anesthesia just goes through your IV. You're not given any gas. You're not intubated or anything. That also is very rare, but again, it's still a possibility. And then the day of the procedure, you'll come in. We just have to ask you some questions. We'll have you change into a gown. We'll get an IV started, get you some IV fluids because you'll probably be pretty dehydrated after you do the bowel prep. And then once they're ready, they'll take you back. And then the procedure, like I said, only takes about 15 to 20 minutes. And then we have to keep you afterwards about 30 minutes. We can get out of here. Usually we tell people to expect about 2 hours for the entirety of the procedure. Okay, so that's about all the basics. I'm not really going to go over the diagram. This is just an anatomy diagram of the GI system. So you can see here, I'll just kind of trace it along as how the colonoscopy starts. So it starts here at the very bottom, goes up to the sigmoid colon, descending, transverse across, ascending colon, back down, and ends here at the cecum. That's the end point. So then once they get there, then they really are viewing everything. This is usually when they do polyp removals, biopsies, get any brushings, aspirates or anything like that. And then they just go all the way back up, down, and then that's it. So I just kind of included that so you have an idea of which direction the colonoscopy goes. These right here, these now are your prep instructions. These are a new tool that we're using for our patients. We wanted to simplify things as much as possible, just because we know that this can be a really scary time. This can be a really scary procedure for you to be having done, especially if you're not used to having a bunch of procedures or anything like that. This is all very new to you. So we try to make this as easy to read. If you have any questions though, as I'm going through it, just stop me. I'll be glad to answer anything. Our number is on here as well. So you'll be going home with this. If you have any questions whenever you get home, or if something pops up along the way, just give us a call. We'll be glad to answer those. So the colonoscopy instructions, these are for you. The procedure is scheduled with Dr. Miller. You're going to report here to our endoscopy center. Our address is here. Sometimes people have to go to the hospital if they're going to have to be intubated. They have any breathing issues, heart issues, sometimes they have to be intubated, so you can disregard that. So you'll come here to our endoscopy center. You're going to get here at 8 o'clock on Monday, the 3rd of May. And then I know this is a lot of information to take in right now, and I know it can be overwhelming. So we also have a brief educational video that goes over the procedure, kind of explains everything again. And then this is on our website, so you could just type that in, and then you can find the video tab, and then select colonoscopy, and it'll give you the information regarding the procedure, okay? And then, so you do have to do a bowel prep, so these are the things that you're gonna have to purchase. 2 10-ounce bottles of the magnesium citrate, and then 3 Dopalax laxative tablets. So you'll have to buy the whole box on that because they don't sell just 3. So this is pretty cheap. I would say probably about $7 for both. So that's all you need to get ready. This is information regarding your medications, so read this carefully. I know you're young, you're probably not on any blood thinners, but if you were, 5 days before the procedure, you'll need to stop taking any blood thinners. If you have any questions regarding that, then call the physician who ordered them for you, and make sure that it's okay with him. If you would feel more comfortable doing that, that's totally okay. You can just make sure that they know. The reason why we want you to stop any blood thinners is because this can increase your risk of bleeding if you have a polyp removed during your procedure, okay? So examples, Plavix, Effient, Brilinta, and Coumadin. Those are the bigger blood thinners. So you'll want to stop those at least 5 days before. If you take these other blood thinners, you'll need to stop these 2 days before the procedure. Again, if you have any questions, concerns, or anything about stopping that, call your physician who ordered them, just so that they're aware that you're going to be stopping them. And if that would make you feel more comfortable just letting them know, then that's fine. So these blood thinners are Pradaxa, Eliquis, Xarelto, and Savisa. So those are what you'll need to start or stop at least 2 days before. And then these are just basic information. It's okay for you to continue taking any aspirin or any anti-inflammatory medicines up until the day of the procedure. I know you just had a surgery, so you may be on some anti-inflammatory medicine, so that's okay to still take. Any blood pressure, heart, or seizure medicines, you'll want to take them with a sip of water at your normal scheduled time, or at least a minimum of an hour prior to arriving at the endoscopy center, okay? If you use an inhaler, please be sure to bring that with you, because sometimes the nurse anesthetist will want you to take a puff before you go back to the procedure. If you're diabetic, we want you to definitely tell your diabetic specialist that you're having this procedure done, just to make sure if they want you to continue on or stop your insulin or any oral hypoglycemic medicines. So you want to bring your insulin if you use that to the procedure. If you're a smoker, we don't want you to do any smoking the day of the procedure if possible. And then, so just a note, if you don't have somebody to bring with you, if you don't have somebody that can drive you home, we'll have to cancel and reschedule you to a different time. And we also want someone with you in case sometimes you're a little bit groggy after the procedure, so sometimes we'll need somebody there to talk to the doctor on your behalf. That's just, just so in case anything needs to be relayed to you later on, they'll remember. And the biggest reason is for safety. You're going to be under anesthesia, so we don't want you driving home. Because like I said, you're considered under the influence, so make sure that you bring your sister or somebody with you that can drive you. You have glasses, so be sure to bring them with you to sign documents. Don't wear any contact lenses because you'll be asleep for this procedure. Leave all your jewelry, valuables, money at home, unless a payment or deposit is required. And once we're done talking, you'll go talk to the financial people and they'll let you know if you owe anything or if you'll need to bring anything the day of the procedure. Some procedures do take longer than others. Sometimes it just happens that way. Sometimes doctors are running behind because they have patients at the hospital. So we may get a little bit off schedule, so we just ask that you're patient with that. Sometimes it's out of our control, and so we just want to remind you of that. Wear or bring warm socks or comfortable clothing on the day of the procedure. That's just so you're warm. It's pretty cold back in the endoscopy center, so we want you to stay warm. And antibiotics. Some physicians in the past have given some antibiotics prophylactically, especially if you've had like a hip replacement or a knee replacement, just because you've got artificial hardware. But according to the ASGE and the AGA guidelines, that's no longer required. So it's not necessary to have any, which that doesn't apply to you anyway, but we don't require that. So 4 days before the procedure, you'll need to stop taking any iron or fiber supplements if they're part of your daily medication regimen, which I didn't see any listed on your medications, so that doesn't apply to you. And then you'll need to stop eating corn and all seed products. This includes flaxseed, chia seeds, popcorn, anything like that until after the procedure, okay? So the day before the procedure, which would be Sunday, May 2nd, you're going to start a clear liquid diet, and you're going to continue clear liquids only, and that's bold and in all caps because that's very important. Clear liquids throughout the whole day before. Clear liquids include coffee, tea, soft drinks, water, clear fruit juices, bouillon, sports drinks, and Jell-O. And I know that sounds weird, but coffee, Cokes, all of that's considered a clear liquid. Alcoholic beverages are allowed in moderation, and then no milk products or solid food are allowed. So no milk products, that includes ice cream, that includes coffee creamer. So you can have coffee, just don't put any cream or anything in it. And then obviously no solid foods. That includes chicken noodle soup. We get that question all the time. Chicken noodle soup still has chicken and noodles, so obviously it's not a clear liquid. You'll need to drink at least 8 ounces of water with your liquid breakfast and lunch, and continue clear liquids throughout the day. At 12 o'clock that day before, take the 3 Dopalax tablets, and that's going to start the whole bowel cleansing process. And then at 6 o'clock, you're going to drink 1 full 10-ounce bottle of the magnesium citrate. If you get nauseated while you're taking it, stop, wait about 30 minutes to an hour, and then restart it, okay? If you can't complete the entire prep or keep it down, then we'll have to reschedule just because you won't get a good clean out. I have found, from my personal experience drinking this, if you mix it with Sprite or Gatorade, it makes it a little bit more tolerable. So you can try that. And then at 9 o'clock that night before, you're going to drink that second bottle. And really, the faster you drink it, the better, because it doesn't taste good, but it's, you know, it's tolerable if you drink it quickly and if it's cold. So try that as well. Nothing by mouth after midnight, with the exception of the blood pressure, heart, or seizure medicines, as we mentioned before. The day of the procedure, no gum, mints, or hard candy should be used the day of the procedure. The cancellation policy, we've just had a lot of trouble with people no-showing or canceling at the last minute, so there is a $100 fee charged if you don't keep your appointment, if you cancel with less than 48 hours notice, or if you don't follow the instructions as we just went over now. Procedure appointment slots are very limited for each physician, and so, you know, if we can kind of help keep things going without any hiccups, and that's better, and, you know, we want to utilize as many appointments as we can. And then again, our number's on here. If you need to cancel or reschedule ahead of time, feel free to give us a call. If you report to the procedure and you didn't follow all of the instructions correctly, we'll have to cancel your procedure, reschedule you. You may be subject to a $100 fee. That's at the doctor's discretion. And we'll have to reschedule. And then the last and most important thing, don't hesitate to call us if you have any questions or concerns regarding the procedure, the prep. If you're not feeling well, just feel free to give us a call. We've got a physician on call 24 hours a day. They can answer your questions even after office hours, so feel free to give us a call at any time. And then our number is on here. Like I said, we try to make this as simple as possible, but I know sometimes, you know, it can get a little confusing. It can be a little overwhelming because this is, you know, your first time having a procedure done like this, which is totally understandable. So just be sure to give us a call if you need anything, okay? Okay, thank you.